Hi, today I'm going to talk about hydroxyethyl starch 130 to 0.42 versus Ringer's acetate in severe sepsis. But first, we have to know what is sepsis. Sepsis is a life-threatening complication of infection. It often occurs in people who are elderly or have weak immune systems. Sepsis happens when the body suffers from an infection and the chemicals release into the blood to fight the infection, cause inflammation over the entire body. Here we can see a video about sepsis. Sepsis is a condition or symptom caused by the presence of microorganisms or their toxins in the tissue or bloodstock. Sepsis enters our body through different sites. Here we can see nasogastric tube, porta cava, decubitus, chest tube, ileal conduit. This is a normal vessel with blood. And then we can see how a bacteria starts to multiply, then it begins to enter in our blood. The bacteria release endotoxins. White blood cells react to the presence of the bacteria. White blood cells release inflammatory substance, and the combination of these is referred to as sepsis. The sepsis shock is the vasodilatation of the vessels. In general, sepsis may occur in between 6 and 30% of all intensive care unit patients, with substantial variation due to the heterogeneity between IQs. But what is severe sepsis? Your diagnosis will be upgraded to severe sepsis if you also exhibit at least one of the following signs and symptoms, which indicate an organ may be failing, like significantly decreased urine output, abrupt change in mental status, decrease in platelet count, difficult breathing, abnormal heart pumping function, or abdominal pain.
North Florida Regional Medical Center has begun a program aimed at one of our nation's biggest killers. Much of that effort will be centered here in the intensive care unit. By using new advanced technology and following guidelines for early goal-directed therapy, the hospital's goal is to reduce mortality from severe sepsis by 30%. We talked with infection control specialist Dr. Robert Yancey about severe sepsis and what we're doing about it.
Severe sepsis is when an infection from whatever source, be it pneumonia or a urinary tract infection, actually affects the body's functions, be it confusion, affecting the lungs, causing low oxygen, affecting the blood pressure, causing low blood pressure, affecting cardiac output. When it starts affecting body functions, then it's severe sepsis. This slide shows the incidence and the mortality of severe sepsis. You can see as they compare it to acute myocardial infarction and stroke, the mortality rate is actually higher and the incidence is comparable. Now, trauma is the other one which we have protocols for, and the incidence is quite high for that, but if you look at the mortality, it's only 1.5%. So the severe sepsis 29% mortality has not changed over the last 20, 30 years until these new protocols were started over the last 5 to 10 years in North America. Well, there was a time when we thought we had conquered infectious diseases with all these wonderful antibiotics we invented in the 60s, 50s, 40s, 70s, and we kind of lost focus on the ball there and started looking at strokes and other types of activities which we didn't have treatments for. But having the incidence of sepsis, severe sepsis, increasing like it is, and the mortality not going down anymore, the focus has been regenerated over the last 10 years.
But what is best? Hydroxyethyl stach 130 to 0.42 or Ringer's acetate? First, hydroxyethyl is widely used for fluid resuscitation in intensive care units, but its safety and efficacy have not been established in patients with severe sepsis. It had a higher risk of death at 90 days, were more likely to receive renal replacement therapy and had fewer days alive without renal replacement therapy, and fewer days alive out of the hospital.
Sepsis is a general term for what is usually a severe infection that infects one part of the body but then spreads with its effects through multiple parts of the body.
Sepsis is very serious. It's a leading cause of mortality. People routinely die of sepsis, and it actually has a higher mortality than stroke and heart disease.
We saw that there was this national movement called the Surviving Sepsis Program, and this was our opportunity to jump in with that kind of a national movement to improve our survivorship for patients with severe sepsis.
The first thing we needed to do was write down a protocol, and we wanted the protocol to be very easy for anybody to use at any time in the patient's hospitalization. And so the protocol was written such that it could be started either in the emergency department if the patient came in through the ER, it could be started on the telemetry unit or the ICU or the rehab unit, wherever the patient was at the time that they developed sepsis.
Our performance improvement chief, Deb Cameron, applied for a Providence program called the ACT grant and received that grant, allowing us to hire on for part-time activity an emergency department nurse who acted as our sepsis coordinator.
My role has basically been to move forward the project, whatever it takes. I can observe and talk to people and find out what people do and how they do it and what would make their lives easier. Then I can identify where improvements are possible, what we can do differently.
This is an ongoing, perpetual process once you start one of these programs. Our severe sepsis order sheet, which is crucial to this process for quick interventions, using the right antibiotics, managing fluid resuscitations correctly, and so on, has gone through about 18 iterations. We've decreased our mortality by approximately 50%. You could statistically say that in the process we saved 61 lives.
We've saved a lot of lives and we've improved care, we've shortened length of stay, and we have saved a lot of money in the process.
The protocol that we wrote is decentralized. It's very simple. The skill set needed by the emergency doctor, the intensive care unit doctor, as well as the nurses, both the emergency department and the ICU, are universal. So there's no reason why this sepsis pathway cannot be championed at other hospitals.
Now is the turn of Ringer's acetate. It is the best treatment for severe sepsis because its effects secondaries aren't too dangerous for the life of the patient as the hydroxyethyl.
Hi Emily, how are you doing? My name's Kerry, I'm one of the nurses. I gather you've been feeling a bit unwell with some back pain and things like that.
It is essential that the 6 steps are carried out within 1 hour of diagnosis. The steps are as follows. Give oxygen, blood cultures, give intravenous antibiotics, start intravenous fluid resuscitation, check lactate level, and monitor hourly urine output.
The Sepsis 6 is an excellent tool for the nurses to quickly identify the really unwell patients. It's almost foolproof, it's systematic, concise, and we can treat the patients really, really quickly. You can see them improve really quickly when it's used properly.
I was feeling sort of sick. I felt like I had a urine infection. It didn't seem like it was that bad to me. Took me through to the ward at the A&E and hooked me up to the machine and to the drip and everything and gave me antibiotics and it was away. Honestly, the team downstairs were amazing. Like when I didn't think I was even that bad still, and you'd sort of see them go, "What is wrong with you?" And they were still trying to make me feel comfortable and have a laugh, but still doing what they needed to do. It was really good, really good. I've been really happy with the staff here actually. It's been amazing.
Patients with severe sepsis who receive fluid resuscitation with hydroxyethyl compared to Ranger's acetate have a higher mortality, are more likely to require renal replacement therapy and stay longer in hospital. The conclusion is that Ranger's acetate is better than hydroxyethyl as a treatment for severe sepsis. Now the final video about sepsis. Well, I hope you had liked this video and think about sepsis and its treatment. The best is Ranger's acetate, like we can see. Bye.